You're watching UNICEF television.
Coming out today, UNICEF's progress report on committing to child survival, A Promise Renewed, examines trends in child mortality and estimates that the number of children under the age of 5 dying globally fell from nearly 12 million in 1990 to an estimated 6.9 million in 2011. Global commitment to this aim was galvanized in June of this year at Child Survival, a call to action, an international conference in Washington, D.C. Since June this year, over half of the world's countries have pledged to accelerating action on child survival.
We're seeing huge gains in reducing child mortality in many low-income countries in sub-Saharan Africa, but also in middle-income countries elsewhere around the world. And I think it shows that no matter what your challenge is, that progress can be made with good policies and commitment to providing the health services that people really need. Things can be done.
The biggest killers of children include pneumonia and diarrhea. Undernutrition is another significant factor. It contributes to 1/3 of all child deaths. If these challenges are to be tackled successfully, broader issues like education, water supply, sanitation, and hygiene will also have to be addressed, and the most disadvantaged reached.
I think it's important that in all countries we continue to target the most vulnerable populations. Even in the most developed countries, there are significant inequities in health, and by concentrating our resources on ending those inequities, ensuring there are access to high quality health services, that there are no financial barriers or any other barriers to access, this is how we're going to achieve this goal.
While the global decline in under 5 mortality reflects the good work of governments, donors, agencies, and families themselves, millions of children under 5 are still dying each year. It doesn't have to be that way. The world has the technology and know-how to save lives with vaccines, adequate nutrition, and basic medical and maternal care. The challenge is to make these available to every child. You've been watching UNICEF television. For more information, go to unicef.org.
You've been watching UNICEF television.